I'm sorry, I was held up in the OPL. So OPL ran up to 3:30. Thank you, our chairman and convener moderator, for allowing me in the middle of the session. My topic is teleophthalmology for eye care at the doorstep. So I thank AIOC's midterm conference and LOC for giving us the opportunity to speak at this venue. Why do we need eye care at the doorstep? As you know, the blindness is a challenge. 45 million in India are visually handicapped, 12 million totally blind, and 1/4 of the world's population, blind population, live in India. Majority of them are needlessly blind, and 80% in rural areas. So we speak about the universal care for everybody. Are we doing that? Because patients are many and located at various locations, equipments and instruments are limited, and doctors are even more limited. So what are the issues for eye care in India? Shortage of doctors. Yes, it's a very important thing. India is one among the countries which suffer from a shortage of doctors. There are only about 20,000 ophthalmologists, or more than 20, just about 25,000 ophthalmologists in India, with most concentrating their practice in the urban localities. And additionally, the infrastructure of our rural areas like roads, telecommunication, transport, and financial status of the patients is very deficit. So it makes it more difficult to provide health care to the people in the rural areas. Eye care, particularly the remote areas, it's very difficult. You know, India is a country with diverse cultural heritage. The geographical location, like remote and tribal areas, play a critical role in delaying the diagnosis in the early stage of the disease, causing needless blind. So you know that these are the areas we serve. We belong to this type of areas in many of the states. And in India, there are about one ophthalmologist per 1 lakh population, and 80% of them live in the urban areas only. And 80% healthcare resources are in urban areas available. But 80% of the people are living in the rural. There's a disproportionate in the healthcare and the people living in the rural areas. Advancement in technology, as the technology is advancing, we have to go with advanced technology. So in the recent, there has been exponential growth in information technology and its impact on all areas, including the medical fields, where accessibility is a major problem because of the inaccessible roads. In order to make eye care services accessible to everyone, the concept called teleophthalmology has come into the picture, and more so during COVID times. So teleophthalmology allowed clinicians to provide quality healthcare outside the clinics through digital technology, thus improving the access to medical care, patient outcomes, and overall patient satisfaction. So this is the teleophthalmology concept. A van well equipped with all the portable instruments goes to the rural areas where either doctor or paramedics take the photographs, and they transfer the images to the people sitting in the urban areas or health centers, basically secondary health centers and tertiary health centers. They interpret the image and immediately transfer and they dictate the treatment to the people sitting in the rural areas. So mostly these are the instruments we utilize for the portable examination of the certain diseases like diabetic retinopathy. Everybody knows a portable fundus cameras are available, where AI incorporated the photographs. In glaucoma also, there is portable tonometer, portable perimeter is available. Refraction, of course, there are portable refractometers are available where you can take the refraction reading and you can prescribe the glasses then and there at the rural areas. And of course, glaucoma and even cataract can be diagnosed through the teleophthalmology. So teleophthalmology enables a doctor from one end to interact with the patient sitting at a distant, remote and a far away place, very unreachable place, either by video conferencing or by data sharing through the computers. Diagnose the patient with the help of a local doctor, and MBBS doctor can do that, even other AIOCMTC doctors can do that. Optometrist, ophthalmic assistant, a trained health worker, if a +2 pass person can be trained how to handle these instruments. He can take photographs and they can transfer the the photographs to the people sitting in the urban areas. So teleophthalmology, all these conditions of ophthalmology can diagnose the disease in early stage like adnexal orbital disease, lead, conjunctival corneal disease, diabetic retinopathy, glaucoma, age-related macular degeneration, retinopathy prematurity. You must have learned about the key drop, from Karnataka. They are doing wonderful, for the treatment of ROP patients in the country, refractive errors, emergency post-operative follow-ups. So objectives of teleophthalmology is to make eye care service available and accessible by the reducing travel cost and the time for the patients, and to enable the people at remote areas to have the access to specialized eye care services which are available for the only urban people. So these are the advantages of teleophthalmology: our extensive outreach, avoiding unnecessary referrals, health education, timely intervention in emergency situation, saves cost, time and effort, and professional opinion. Lastly, but not least, the protection against infection, which is COVID infection. It was there during COVID times. So I would like to give a message to the people sitting here that teleophthalmology is the only solution for patients who would otherwise not have access to an eye care professional to be screened and treated earlier by their doorstep by the paramedics to prevent permanent visual complications. So we are only 20-25 the ophthalmologists. The paramedics, about more than 40,000 paramedics are available, optometrists, ophthalmologists. So let us utilize them. Let us train them how to take the photographs of various IDJs, and then they can transfer the data to us and we interpret and treat them. So through teleophthalmology, all the urban treatment and modern treatment of ophthalmology can reach the rural people for which we are working. So universal eye care, the teleophthalmology the only solution for the universal eye care which can give each and every individual of the country, which unless they become needlessly blind. So for which we have formed the Teleophthalmology Society. It was born during the COVID times, 1 year back. It's growing slowly, and I request all of you to become this member and reach our hands, enhance our technology to the rural areas. Now the 5G have come, there's a faster delivery of the images to the urban areas. So please come forward and be a member. Already there is a website, the tosi.org.in. Please go into the website and give your membership money through the online. So thank you very much. Last but not the least, a small appeal to all of you. I am contesting for the post of editor proceedings. Please help me in getting this editor proceedings in the AIOC election 2023. So thank you very much for the patient listening. Thank you, judges, giving the opportunity once again.
Thank you, sir.